kind of a logical next step that came out of that effort to develop that classification system was to identify sort of minimum testing standards. And where we kind of left it was what you need or what we recommended for establishing each one of those, establishing a herd in each one of those categories. And I think everybody that was involved in that kind of felt a little bit ampty at the end of that we, after we thought about it more and realized how all the complexities that we couldn't take it a little bit further. But so the objective of this working group, I guess, that Bob, and by the way, I'll preempt you then, it's Bob, Dale Polson, Paul Yeske, and Monse are the committee. Monse just joined us at the back of the room, so good timing. Oh, and Lee Rosegren. I'm sorry, and Lee's not here today. Yeah, thanks. And so the objective of our group then is to develop a set of guidelines/standards for minimum testing strategies for PRRS virus. And the way I wrote that purposely, this guidelines/standards, and that's not in the proceedings, but I added that later. I purposely put it that way because I see that as kind of a continuum there. And all the way from a guideline being just kind of, we suggest you do this, to a standard, which means then that it's going to carry some weight, that we want everybody to adopt that, everybody's going to use it, and there's a reason to do that then. The other term that I purposely didn't use was certification, and that's what Lee and others are doing in Canada, where now that has some additional connotation about third-party audit or third-party verification. It's going to mean something from a legal standpoint, perhaps, and other things like that. And so I purposely left that off, although certainly that could be part of this discussion. The intent here is not to cast something in stone, and that's why, again, the certification left off, but to serve as a starting point for practitioners. So the way I view this in regional coordinators, the way I view this then is sort of a collective wisdom that develops a conceptual framework and then hopefully comes to some consensus and then can develop those guidelines or standards. And why do we want to go to that effort to do that? Because it's going to take time to do that, and there's some chance that everybody will ignore it and it won't mean anything anyway. So why go down that path? Well, I pose that as a question at the end, so I'm not going to suggest that I have the answer, all the answers to that necessarily, but certainly from a reinventing the wheel standpoint, that's why I asked Jim how they came up with those the protocols, the testing protocols that they developed there to prove the status. Each time somebody does that, it takes effort and time, right? And Jim's was based on pretty good science. Sometimes we just kind of lick our finger and stick it in the air and come up with a number because that's what we've done in the past and it worked before. So the idea of having something out there that sort of serves as a guideline that you can go to, and maybe you tweak it a little bit, but it's there. To me, it's like the guys that have 15 white shirts and 20 khaki pants in their closet, right? Every morning they get up, they have no decision to make. They throw on a pair of khaki pants and a pair of white shirts. I've always been very jealous of those people. I think that would be great to be able to do that. But that's the idea. So you sort of standardize things so you don't have to think about it. So I'd like to say I chose that example on purpose, but I just threw that in. I'm close to it anyway, not quite there. But that's the idea then. And certainly from a regional project standpoint, Bob, you would say that, it would really be nice if we had a standard testing protocol or standard test that we all were doing. And so that it'd be apples to apples. We could measure progress on all these equally. It'd be an equal comparison. And so certainly from that standpoint, it would be great. From a, national eradication standpoint, we're not anywhere near there, but for pseudorabies, right, it was absolutely mandatory. It was required that there had to be, defined testing, acceptable testing procedures, right? And so there certainly are reasons, I think, good reasons to take this effort or take on this effort. But I'd like to hear what you have to say about that as well. That went the wrong way. Yeah. 2 slides ahead. There we go. So for this discussion, just to get this started, I'm going to focus on the expected negative populations, but really expand that just a bit in that what I call the establishment there, and that's really a transition from positive to negative. So that's the category 3 provisional herd, negative herds. As you're going from category 2 to category 3, you're trying to establish that that herd now is negative. And so some of the time where you're testing, it may still, you may still find positives and expect to find positive, but as time goes on, you start expecting to find negatives. And so we include that. And then maintenance, of course, once you get there, once you get to provisional negative or negative, then there's some expectation that those will always be positive. And so if you're monitoring on an ongoing basis, then that's what we're considering here. Yeah, I think I'll give up on that. All right, one of the things that came out of that herd classification effort was this table. And I think this is to me, this is a nice collection of what you need to think about or what we need to think about when we define a testing protocol. I said standard there, but probably a better term would have been a testing protocol. And so it's, what test are we going to use? Not necessarily in the order you think about these, but what test are we going to use? What animals are we going to test? What specimen are we going to collect from them? Are we going to do the whole herd? Are we going to select a sample? If we do a sample, how do we select that sample? How many do we choose? And then do we pull those before we pull the samples? Likewise, minimum number of times we're going to test, and the frequency, or how far between are we going to go out and test, or how long do we wait before we test again? And of all of those, and then, well, let me stop there. And of all of those that I've mentioned so far, there's good. I would say there's probably, everybody in this room would agree that there's relatively good science in all those. The one that's really probably lacking is the frequency. So we don't have a really good, strong basis for saying frequency, and so most of the time it fits nicely in the conceptual framework I'm going to propose here, where you have to think about, okay, why are we doing this, basically, and then what is the consequences that if we don't detect it, and then what kind of risk are we facing as well. So that's, in my opinion, that frequency is the tough one, the toughest one of those. And then finally, to finish off the table, if you're assuming you're sampling, you're taking individual sampling, even if you're just sampling, or even if you're taking the whole herd, you're still testing individual animals or individual samples. How do you interpret then the results to say something about the herd? So that's kind of what we call the decision rule for classifying the herd based on those individual samples. And then, of course, the target prevalence and the confidence level are related to your sample size. Then you're going to have to determine that. The other thing, real quick on that, Bob, the other thing it occurred to me while I was listening to Jim talk is that the other thing that might need to be included would be, when do you start in some cases? And that is for example, if you're trying to eliminate the virus with herd cohesion rollover, when do you start testing those pigs, or when do you start testing them more frequently? So you may be testing monthly, but at some point you want to test maybe weekly as you get closer to the time you're going to enter the negative gilts. And so when do you start these? And so there may be multiple testing strategies, and the other variable then would be, when do you start them? Okay. So here's the conceptual framework then that I'm going to throw out today, and doesn't mean this is the conceptual framework, but it's the one we've kind of been thinking of. And Bob has used this term risk-based sampling for, I don't know, a couple of years now at least, right, Bob? Probably longer than that. I just didn't pay attention before, but now I do. But I think when Bob has talked about it, he's really focused on the left-hand side of the probability of infection. So looking at, what are the risks facing that herd? Is it likely this herd will, if we have a negative herd, how likely is it it'll become reinfected? All right. So depending on that, then depending on how likely it is, we might modify our procedures based on that. The other part of it, to just kind of complete that picture in my mind, is the question of why are we testing? What are we trying to do? What are the circumstances around which we're testing? And I'll give some examples here. So you go ahead. So first, the probability of infection. I'm just going to throw out, again, this is just to facilitate discussion here. I said, let's put 3 levels. We'll call them high, moderate, and low. And I threw up some examples that might sort of characterize the high, moderate, and low risk herds. Okay, there's lots of risk factors. And so I just threw 2 or 3 up there for each one of those, okay? But that's the idea, right? And then, now the second part, of course, that was the left-hand side. The right-hand side, then, is the consequence of testing. Why are we testing? Why are we testing? The consequence if we miss an infection or detect it late. And I For this, I defined, again, 3 levels: high consequence, moderate consequence, and low consequence. And this slide is for the high consequence. So the circumstances for that would be, this is maybe the highest consequence circumstances I could think of, where you're testing a boar stud that sends semen to multiple breeding herds, many of which are in category 3 or 4, so they're provisional negative or negative. And many of those herds are genetic herds. So you might be multiplication herds or daughter nucleus herds. And so I couldn't think of a situation where the stakes were higher. Why are we testing then? To determine if the negative PER status of the boar stud is maintained, expected negative. We want to try to avoid using infected semen in breeding herds. That's why we're testing. Consequences if we miss are major. Right? We got not only productivity losses, breeding herd cost of depop, repop, the boar stud, increased animal health costs, lost genetic supplies, on and on. It's a long list. Most of the people who have gone through this know that we're not talking about hundreds of thousands of dollars here, even it's easily millions. So even for relatively small studies. All right, here's a moderate scenario. This one I said, and you might argue this isn't moderate, maybe it'd be low, but I put it up there as moderate. Population tested as weaned pigs from a commercial breeding herd. The herd's currently in category 2, so it's positive stable. All right, and the pigs are commingled, and the pig flow can be modified in the near term. That's the other circumstances here. So why are we testing? Well, we're trying to determine, whether or not to vaccinate these pigs, maybe, or it may affect the how we flow these pigs, or it may alter the biosecurity in neighboring herds, for example. So the consequences of missing infection or detecting it late, though, then are moderate. Maybe we have some productivity losses in growing pigs or some increased animal health costs. And then for low consequence, the circumstances I put up were population that's tested as finishing pigs just prior to or at harvest, and basically a pig that we knew was negative at placement. And so why are we testing? Well, we're just trying to build a database to better understand how frequently those groups of pigs that are placed at negative at weaning, how often they go positive. So it's more of a information exercise, right? We're not gonna do anything in response to it. We're just trying to learn. And so the consequences are relatively minor. If we miss it, we just miss out on that information. Okay. All right. So here, I picked another example again here. Minimum testing standard, moderate consequence of infection, moderate probability of infection. Bob, go ahead and the next one, please. All right, click on that one. And so I just threw this up here. Maybe this is this would be the guideline that we potentially would propose, or the standard if it, we decided to call it a standard. But again, it's just that same table we talked about before. And actually what I did here was I pulled this one out of the ASB, the JSHAP document that we used to describe the herd classification. And so this was what we proposed would be the requirement to establish that you are category 2 positive stable. Okay, so this would be an example of that. But then we might have something similar to that if you were trying to monitor that over time, and Jim, to prove that you were still there. And so to try to catch maybe those periodic times where you were spitting out negative pigs, or positive pigs, I should say, then that how often do you want to monitor to sort of determine that? So, all right. So here are the discussion topics. Then, again, when would minimum standards be beneficial to the industry? That's where I started that with that question. Would it be enough to develop guidelines, or do we need to develop standards, or is all we need just some more information on the conceptual framework? I'm not sure which way to go on that. Is that risk-based sampling what we propose? Is that a good conceptual framework to develop guidelines or standards? And here's this second to last question. This is where I really start getting stumped by this, and that is can we develop minimum standards for every combination of circumstances and probability of infection? You start thinking about that, and there's a lot. That's probably not doable. So if we can't do that, what can we do that would be beneficial?